I'd like to start with where did COVID-19 come from? I think by now we all realize that the illnesses were first identified in Wuhan, China. However, now that it is a global pandemic, it's present in at least 160 countries, territories, or areas. The exact source of the virus has not been confirmed. We do know that coronaviruses infect animals, and those can become able to infect people. A potential source is a wet market in China where live animals were sold for food. The symptoms of COVID-19 are primarily people will exhibit a fever, a cough, which is dry, and shortness of breath. Primarily, people will have a fever of 100.4, a dry cough, shortness of breath, and some are also reporting fatigue. Using the pattern from another coronavirus, MERS-CoV, also called Middle Eastern Respiratory Syndrome, experts believe the symptoms will appear 2 to 14 days after exposure. Some people have one of these symptoms, some have multiple, and some people who have tested positive for COVID-19 report no symptoms. It's also important to understand that these symptoms can also be present with other illnesses such as influenza, common cold, and seasonal allergies. It's believed that the incubation period for COVID-19 is between 2 and 14 days. So how did we get here? How did this happen so quickly with breathtaking speed? The virus has shown that its growth is exponential, not linear. With linear growth, the numbers per day would be about the same. For instance, 500 new infections per day. After 11 days, there'd be about 5,500 people infected. With exponential growth, the base number doubles with every time span. For example, with exponential growth, 500 infections grow to more than 1 million after 11 doubling periods. After 10 more doubling periods, it would reach 1 billion. This is in no way a prediction for the number of deaths that we should expect or illnesses. It's a reminder that exponential growth leads to a very large number very quickly, even when starting from a low base. So what is our doubling time? Well, epidemiologists suggest the doubling time for COVID-19 is likely around 6 days. However, in the absence of testing, it's difficult to know exactly what the doubling time frame is. Without a vaccine or effective antiviral medications, other strategies must be used to slow down the spread of the virus. These include self-isolation, social distancing, and in some cases, what they're now calling shelter in place. When you hear the term flattening the curve, they're talking about pushing down the number of new infections each day in an effort to avoid overwhelming our systems, which we've seen in Italy can happen very rapidly, especially our healthcare systems. They may have trouble accessing resources to treat extremely large numbers of patients all at the same time. Social distancing is meant to contain the growth to allow hospitals and healthcare centers to continue to be able to treat everyone who needs care. What about the United States? Well, as of this week, there are confirmed cases in every state in the US. Currently, certain locations report a higher case load and more community transmissions than others. We hear a lot about California, New York, and some other locations that are experiencing high community transmissions. But the experts tell us that we're still in the early phases of this pandemic in the US, and it's not too late to make measures to slow the transmissions. And this is whether or not you're in a hot spot today, because as we've seen in the recent weeks, this changes on a daily basis. To understand infection prevention and infection control, we always have to first understand how diseases are transmitted. And it's different for different types of diseases. Obviously, in healthcare, we're very familiar with bloodborne diseases and bloodborne disease transmission, but I believe we're less familiar with diseases that are transmitted through droplet or airborne mechanisms. So the primary way that COVID-19 is transmitted is through close contact, that's within 6 feet of a person who's infected and is coughing or sneezing or otherwise releasing droplets from their respiratory tract. There's no documentation of spread via contaminated surfaces. It's important to know that we don't know a lot about this disease yet. It is too early, but there was an article that was published this week in the New England Journal of Medicine that the virus is believed to survive up to 2 to 3 days on certain surfaces like plastics and stainless steel, and up to 3 hours in aerosols. It is really important to note that this was a carefully controlled lab setting, not necessarily duplicating what would happen in a clinical setting. In addition, viral survivability does not necessarily indicate viral infectivity. There needs to be an adequate number of pathogens in order for disease transmission to occur.